Are there different types of mesothelioma? There are 4 types of mesothelioma defined by tumor location: pleural, lung lining; peritoneal, abdominal lining; pericardial, heart sac; and testicular. Mesothelioma is also identified by 3 cancer cell types: epithelioid, sarcomatoid and biphasic. Types of mesothelioma by location and cell type. The types of mesothelioma are based on the location where the cancer develops and its cell type. For example, when it forms in the pleural lining around the lungs, the cancer is called pleural mesothelioma. The most common location where mesothelioma forms is in the lungs, but other locations include the abdomen, heart and testicles. Each mesothelioma type can lead to different symptoms. Treatment is tailored by cell variety. The prognosis varies by mesothelioma tumor location. 2. Primary types of mesothelioma by location and cell type. 1. Pleural mesothelioma, lungs. 2. Peritoneal mesothelioma, abdomen. 3. Epithelioid mesothelioma, epithelioid cells. 4. Biphasic mesothelioma, epithelioid and sarcomatoid cells. Rare types of mesothelioma by location and cell type. 1. Pericardial mesothelioma, heart. 2. Testicular mesothelioma, testes. 3. Sarcomatoid mesothelioma, sarcomatoid cells. 4. Other rare cell subtypes, including well-differentiated papillary cells, small cell, deciduoid, cystic, desmoplastic, adenomatoid and heterologous cells. Pleural mesothelioma. Pleural is the most common mesothelioma. Approximately 70% to 75% of cases occur in the pleura. More research has been conducted on this mesothelioma tumor than any of the others. Most patients qualify for chemotherapy, radiation therapy. Some may qualify for immunotherapy. These therapies can add months or years to life expectancy. Characteristics of pleural mesothelioma. Location: pleural lining, chest. Symptoms: shortness of breath, chest pain, weight loss, fever and fatigue. Prognosis: with treatment, 3+ years at stage 1 versus 12 months at stage 4. Peritoneal mesothelioma. Peritoneal disease accounts for 10% to 20% of mesothelioma cases. There is less research available on peritoneal compared to pleural, however, the prognosis for this tumor type is better. According to research, around half of peritoneal mesothelioma patients who have surgery and heated chemotherapy, HIPEC, live 5 or more years after diagnosis. Characteristics of peritoneal mesothelioma. Location: lining of the abdomen, peritoneum. Symptoms: abdominal pain and swelling, bloating, loss of appetite and bowel changes. Prognosis: 52% live at least 5 years after surgery with HIPEC. Pericardial mesothelioma. The pericardial tumor type is extremely rare. Around 200 cases are reported in medical literature. With surgery, some patients live for years beyond the average 6-month life expectancy. Characteristics of pericardial mesothelioma. Location: lining of heart, pericardium. Symptoms: irregular heartbeat, chest pain, difficulty breathing and cough. Prognosis: typically ranges from 6 weeks to 15 months. Testicular mesothelioma. Testicular mesothelioma develops in the lining of the testes. This form of mesothelioma is the most rare. Less than 100 cases are reported in the medical literature. Treatment options include surgery and chemotherapy, which can help people live more than 2 years after diagnosis, on average. Characteristics of testicular mesothelioma. Location: forms in the tunica vaginalis, which is the lining covering the testes. Symptoms: scrotal swelling, painless testicular lumps. Prognosis: 2 years. 3 types of mesothelioma cells. The 3 mesothelioma cell varieties are epithelial, sarcomatoid and biphasic. Biphasic is a mix of the first 2 cell types. Mesothelioma doctors can tell the difference between cells based on how they look under a microscope. Different mesothelioma tumors respond differently to treatment. Epithelial or epithelioid cells respond the best, and sarcomatoid cells are more resistant to treatment. Cancer doctors take these differences into account when planning your mesothelioma treatment. Incidence of these cell types varies by cancer location. Epithelial cell mesothelioma. Epithelioid mesothelioma makes up approximately 70% to 75% of all cases of asbestos-related mesothelioma cancers. Epithelioid cell has the best prognosis. It tends to be less aggressive and doesn't spread as quickly as sarcomatoid and biphasic cell disease. About 50% of pleural disease is epithelioid. Around 75% of peritoneal tumors are made up of epithelioid cells. Sarcomatoid cell mesothelioma. Sarcomatoid mesothelioma is the least common mesothelioma cell category. It is the most aggressive and difficult to treat. It accounts for around 10% to 20% of all mesothelioma diagnoses. You may hear sarcomatoid mesothelioma referred to as sarcomatous, spindle or diffuse malignant fibrous mesothelioma. About 20% of pleural tumors are sarcomatoid, while only 1% of peritoneal mesothelioma are sarcomatous. Biphasic. Biphasic mesothelioma refers to tumors that contain epithelial and sarcomatoid cells. Life expectancy after diagnosis with biphasic mesothelioma depends upon which cell predominates in the tumor. More epithelioid cells generally mean a better prognosis. If the tumor is mostly sarcomatous, it is harder to treat and life expectancy is shorter. Around 30% of pleural and 25% of peritoneal tumors are biphasic cell. Based on the limited number of cases reported in the medical literature, pericardial mesothelioma exhibits roughly equal distribution of the three mesothelioma cell types. Approximately 2/3 of testicular mesothelioma cases are epithelioid cell. The rest of testicular cases are biphasic. Only one case of purely sarcomatoid cell disease is reported for testicular mesothelioma.